just wish, it just stayed there for all day, all hours. Now, with the new procedure, the contour thread facelift, it could happen in the doctor's office without having to go into the operating room and with a quick recovery time. Joining me now to talk more about the contour facelift is Dr. Stephen Davis of Davis Cosmetic Plastic Surgery in Cherry Hill, New Jersey. Welcome back, Doc.
Welcome. Hi, how you doing?
I'm doing well. Happy New Year to you.
Same to you.
Let's talk about the contour facelift. Why is this procedure so special?
The exciting thing about it is we know that men and women for years have understood that there's a way to lift faces, lift brows, necks. But the cool thing about this procedure is that it can be done in a simplistic form in the office under just local anesthesia, and you get a very refreshed look.
All right, well, let's take a look at the full screen we have of one of the patients you have here.
Okay.
Her name is Kathleen, who had the procedure done about a month ago. This is the before look, right?
Correct.
All right, and as we look at the face, there were some things she wanted done.
That's exactly right, and that's what happens. Patients come in and there are areas of the face that begin to sag, and patients can come in and we can specialize this. We can actually go over with the patient special areas of the face that they want to have repositioned.
And Kathleen joins us now in studio with a look at what she looks like now. There she is. Kathleen, good morning.
Good morning.
And we're looking at the difference. Yeah, what made you decide that you wanted to get this done?
I've been taking pretty good care of my skin, and I just wanted to freshen up my look.
I understand. And so you decided, why not seek a different option? Why not look at the different options available?
Yeah, I thought about a full facelift, and then I had gone to Dr. Davis, and we talked about getting the thread facelift, which is not as invasive as a full facelift is.
All right. Well, let's talk about the procedure, Doc. Well, what happens as we look at, as you try to tell our viewers what's happening?
The patient comes in and under local anesthesia.
Local anesthesia, so they don't have to go to an operating room.
No, not at all. Kathleen and I actually were talking during the entire procedure.
Okay.
Yeah, she said she actually got bored at some point during the procedure too, but basically what ends up happening is we inject the face with some local, and then we target the specific zones of the face where we want to resuspend them. And you can do that basically in the brow, in the mid part of the face, the jowls, and the neck.
What are you doing here? Are you pushing the skin back like a regular facelift?
The threads have already been placed, and now what we're going to do is resuspend the skin and the tissues under the skin onto these small little barbs of, they're like cogs or very fine hairs. And I've actually brought a sample of one of these things just to show, if the camera can come in on that, just to get a sense of what we're talking about. This is actually a piece of the thread, and what it is, they're very tiny little hair-like barbs that help to hold and suspend the tissues.
Kathleen, while this is going through, while the doctor is injecting this thread into your face, what's going on? Are you in pain? Are you wide awake? You're having a conversation?
No, I'm awake. I didn't feel anything.
Right.
Didn't feel anything at all. You could feel it going through, but it wasn't painful. All
right. Post procedure, how was it like during that time? Afterwards. Actually, the most thing for me was you have to sleep elevated for a week. I found that the most uncomfortable thing to do because I like to sleep on my side. Right. And the adjustments. How was the swelling? Were you able to go out after a couple of days, couple of weeks?
No, I was home for about 8 days.
All right. And then how many times did you have to go back to the doctor's visit for post visits?
2-3 times.
Right.
That's a good part about this, though, because, again, these tissues are placed on these cogs, if you will, and I see these patients for at least 2 weeks because you can continue to reposition these cogs so that if the face is a little bit too high at some point, you can actually drop it down. So it's an adjustable, if you will, facelift.
But this is not the full facelift, for example, that we've seen some artists have, some people in Hollywood have, right?
Exactly. And that's available, too, and that's why I was saying that's always been available. Someone that's really looking to just refreshen their look a little bit without going through a bigger procedure, this is really the way to do it.
Cost?
Somewhere between, I'd say, $2,500 to $12,000, depending on how many zones of the face that you're really trying to reposition.
Insurance covered or no?
No.
Insurance does not.
It's all cosmetic surgery.
So this came out of your pocket, basically.
Yes.
Are you glad you did? Are you glad you made the investment?
Yeah. Yep, I'm very happy.
What's the benefit to you? Tell me.
Benefits? I feel better about myself. I look better.
And you feel good?
Oh, yeah.
And that's really important.
Yep.
All right, you look fabulous as well.
Thank you.
Your husband's over there, he's smiling. He's saying, I agree.
He was actually in the room while we were doing the procedure. He's a very interested guy.
All right, okay. Thanks so much, Kathleen and Dr. Stephen Davis of the Davis Cosmetic Plastic Surgery in Cherry Hill, New Jersey. Thanks for your time, both of you.
Thank you.
Have a happy New Year.
Thank you.
All right, Gwen, over to you.